And welcome back to Good Morning Tobago right here on Tobago Updates. Guys, if you're just joining us, you missed an incredible conversation with Dr. Vanessa James on the state of the economy here in Tobago, as well as a bit about the THA reshuffle. But as we continue our discussions this morning, we're talking a bit about what's happening at the level of the TRHA, which is the Tobago Regional Health Authority. And to have this conversation with me this morning, I am speaking with Mr. Max James. Good morning, sir.
Good morning, Shenell.
All right, it's always a pleasure to sit with you and have these discussions. Now, this morning we're talking to you in your capacity as a former member of the TRHA board.
Indeed.
Right.
Yes.
And so you were privileged to a lot of the developmental milestones that took place during your time on the board and what is happening now, because I'm guessing that you have been following on what's happening. Now, Tobago saw the tragic death of a young mother, Nadia Shanghai, and her baby very recently. And as that story unfolded, there's a lot that happened in the background that the public may not have had the privilege of understanding or knowing, that you may be able to speak to a bit this morning, and how that plays into the state of the TRHA as we speak.
Well, certainly. So let me say good morning to the viewers. And, I'm an angry man. I'm very angry because for simple interventions that could have been done in terms of policy, we have not seen the emergence of policy that could have prevented what has happened. No young woman who is pregnant and is about to deliver a baby should die. We have too many modern facilities and equipment to prevent death of a mother and a child. I recall when I was on the board of the TRHA in 2015, 16, thereabout, that we had the death of Rose Gordon. And I don't even want to recall the ghastly circumstances under which she had undergone just before that. I recall, and let the viewers know, I recall, along with Dr. Maternal, to have developed a proposal called TIGO, T-I-G-O, Tobago Institute of Gynecology and Obstetrics. That death had brought home the need for that institution under the auspices of the Royal College of Obstetrics and Gynecology in England. We did all of the work and presented to the board and then to the Secretary of Health at the time, Honorable Tobago Duke. Eventually, it has not seen the light of day. The idea behind TIGO was to have used the palms that is contiguous with the land that the TRHA owns at Signal Hill. You know, when you come back in the old road and that old hotel that is there being unused. So those lands are contiguous or adjoining the property of the TRHA. So they were going to be used as dorms. We have all of the audio visual facilities at the hospital, and it was just to have the students, both nurses and doctors, women who will be trained properly in midwifery, but with an obstetric and gynecological focus as well. And of course, so that we'd have been churning out students 5 years now down the road, had that proposal been accepted. This present case shows the need for such a facility again, because women and children continue to die without childbirth, during surgery, and the lot. So what are we going to do? I recently discussed the matter with the current chairman of the board, so I'm waiting to see what will be the outcome of that. I gave the current Secretary of Health the proposal for the establishment of Tobago's Institute of Gynecology and Obstetrics. I'm still waiting. That is 2 years now. The chief secretary is on record of saying that we must get to the bottom of this. And so I'm going to support him there. But he's on public record of saying we must understand what has happened in this particular case. We have to know. The public has a right to know. And I would have thought that the Secretary of Health and the Board of Directors and the Chief Executive Officer would have properly come before the public and take questions, to have a proper news conference, proper answers. So I'm calling on the Chief Secretary and the Deputy Chief Secretary, who happens to be the Secretary of Health, the President, all who can be involved in getting to the bottom of this. This is not a question about party. The PDP came into office people before politics. And you know, sometimes some of them are angry that I speak out on these things. It could have been my daughter. It could have been you, Shenell. It could have been any pregnant woman in Tobago. That comes before party.
Understood.
And yes, go ahead.
And during an interview that I had previously with the then CEO, Dr. Nathaniel Duke, he indicated that the Roxboro facility was fully equipped and able to deal with these type of cases. Do you think that had the facility been running at a 24-hour capacity, that it would have been able to facilitate this young woman and maybe,
of course,
even combat the death that we saw?
I understand the core issue is that they don't have a cadre of midwives. The midwifery unit is not functioning, it's not properly staffed. When they have a lot of those persons at Signal Hill, why it is that everything that has to be done in the country, that the country or Eastern Tobago has to suffer. A woman checks in, she is given all the emergency interim interventions, and then sent 50 minutes away. What has happened as a result of that? We can't have a modern facility with all of the equipment. Let me just read out a few of the things so that the public will know. The emergency room is not open 20. That's the emergency room, not open 24 hours. When we have enough doctors, nurses, and ward attendants, that's a fact number one. Fact number two, we have X-ray to work on call. Fact number three, Roxboro has a lab, and they have a plan to have labs at night and on weekends. Fact number four, there's a system for filing at night as what is done currently at Signal Hill. The operating room is the most advanced room in Tobago. It is even better than Signal Hill. That's what Roxboro has. That's the operating room. And then they have, in spite of that, millions of dollars in equipment are in storage. They have consultants highly trained in OBGYN, anesthetics, or in anesthesiology, critical care, and internal medicine. You have Dr. Singh, who is the venerable Dr. Singh, and Dr. Jagannath. So it's not that they didn't have any persons who could have made interventions, but yet she had to travel to Scarborough because the board has not instructed or didn't do the correct thing to have that full cadre of midwives who, as they say, are critical in respect of what has happened there. They must be part of the system.
So can you explain to the public a bit? You're saying that the reason why the surgical interventions were not done at Roxboro and the patient had to be sent to Scarborough is because there were no midwives at Roxboro?
That is the information that is emerging. That is the information is there. If you had a full cadre of midwives, as is the contention, you must have that unit of critical care people who involved in the delivery of our children. Then what is preventing the CEO and the board of giving that instruction, making the person available? You're talking about 2 years down the road. So if you're saying that, if you're going to say that you don't have the personnel, what is preventing? What is preventing of sharing the personnel? What is the current hospital administrator doing? The tail can't wag the dog. I understand that there's this internecine warfare between Roxboro and Scarborough. That has to end. Roxboro must be fully staffed. You talking from Goodwood right back to Lansing, Bloody Bay, Charlottesville. And our women who are pregnant, or wives and daughters who are pregnant, they must be afforded the best care that Roxboro is able to provide. And so I am putting the blame squarely at the feet of the Secretary of Health, the Board of Directors, and the Chief Executive Officer. They needed to come together to fix that problem. I'm sure, as a former secretary myself, and former administrator in my own right, and business consultant, management consultant, you must identify on a monthly basis or daily basis what the human resource problems that you are faced with and fix them. We can't wait to see our daughters and our mothers and our pregnant women or babies die. Imagine a woman is going for 9 months at a time of joy. Baby dies and mother dies. Because the system did not cater to deal, or has not catered up to now to deal with its deficiencies, rather than everybody fighting with each other.
Understood. We're going to take a quick break and we're going to be back with lots more, guys. See you soon.
MI4 Security Services Company is the most advanced security service in Tobago. Ask about our cash and transit service. It's
morning, rise up to a brand new dawning as the passion starter.
Good morning and welcome back to Good Morning Tobago right here on Tobago Updates, guys. We have been having an interesting conversation with Mr. Max James on the state of the TRHA. If you do not know, recently we saw the death of a young mother and baby, a young mother by the name of Nadia Shanghai, who died at the Scarborough General Hospital. Now, as we continue the conversation, we're talking about how equipped the Roxboro Hospital is to take some of that weight off of the Scarborough Hospital and allowing persons within that eastern side of the island to receive the type of care that they need within quick time. Mr. James, as we continue, you will listing out a number of facts about the level of preparedness of the Roxboro Hospital to be open 24 hours and service the public. Now, I know you are not the chief secretary, but do you have any ideas as to why we haven't seen that, although we have been promised that?
There are many times the politics must drive the society in a way that is beneficial to the society. You said people before politics. Okay? And therefore, I expect you to govern that way. No, unless the chief secretary is true to his word, right? Unless the chief secretary is true to his word, then we will have a problem. This party came into power saying people before politics. So I don't really care whether they like me or not. The idea is that the truth must be told. And so let's go to fact 5. I'll just repeat fact 5. The operating room is the most advanced in Tobago, and yet millions of dollars in equipment are in storage. They have consultants training highly in OBGYN, I think I said it before. And they have pediatric consultants and emergency medical specialists. They can do blood transfusions, and they have done several, even for politicians right here in Tobago. Fact 9, the board and the CEO has not given permission to open 24 hours or to do any general surgeries or C-sections. So either what, they could come and refute it and say what they have done, or why they're not doing it. But it needs to be done. If they're going to refute this fact, let us hear what you're doing and what are the problems you're having. But we can't afford to have women continue to die in Tobago. You know, a place like Gaza, up in the Middle East, they have several hospitals with just over 1 million people. Several. The interventions must be undertaken to make Roxboro fully functional. There's no excuse. They have blood storage refrigerators for holding blood for patients. The facility sees over 1,200 patients a month. They have one of the most modern CAT scan and ultrasound machines. They have dialysis machines ready. The facility has been like this for over 2 years, almost like at the hands of this board and the current CEO, who was fired from his job at the PTSC. And he's bringing the same inefficiencies here to Tobago. He wasn't hired by this administration, but they inherited it. So the CEO have to hold his feet to the fire. Instead of making a lot of bad decisions or not making any decisions, Tobago East is suffering. The young women and parents are suffering in Tobago East. The hospital, there's nothing preventing it from being fully opened in the way it should be done, so the physicians can do their work and the people can have confidence that if they are pregnant, that they will be well taken care of. They don't have to go to Signal Hill, either die on the way or die by the time they reach there.
But Mr. James, you're saying that nothing is stopping them from doing it. Do you think that truly they would not open it for no reason? There must be some sort of reason behind it.
If it is that there is a medical reason behind it, let us know. I doubt there is. I know they will try to come and say so.
So what are you suggesting is the reason why the hospital has
as
not
I
been
told
open to its
a
full
good friend on the
capacity?
board, I can't say who it is. I said, haven't you all resigned as yet? The board should resign. The CEO should be fired. And even the Secretary of Health should be called into account. The Chief Secretary said he'll get to the root of it. And I'm going to take him as his word. No young woman in Tobago, and especially from Tobago East, because we live in Tobago East, should die when you have all the facilities, you have the equipment, you have the specialist medical personnel. What is the reason? Some midwives, and you have so many in Scarborough. Well, get them up in Roxboro. Transfer some of them in Roxboro. And if it is that they had taken these proposals seriously for the establishment of Tobago's Institute of Gynecology and Obstetrics. But in Tobago here, we like to fight on each other. I don't like you, you don't like me, so nothing can be done.
Understood.
And therefore, the business of the people is left behind in the doldrums and people are suffering. It is time for Roxboro to be fully operational. I'm calling as a citizen of Tobago East. I have 2 daughters, right? I have relatives. Now, whether I had those persons or not, the women of Tobago need to be protected when they are pregnant. We had a maternal death in Rose Garden from Charlottesville. Nothing came out of it. I remember going with the woman's sister to Port of Spain, delivering letters, writing senior counsel. Nothing. So when women die, nothing comes out of it. And that must stop. So I'm speaking up for pregnant women and families, husbands, boyfriends, who must and should get the proper care. We have the facility, we have the equipment. Let us know what has happened, Mr. Chief Secretary. You have given your word, and I'm holding your feet to the fire. You must set up an investigative tribunal or committee or investigating team. Let us know what has happened. If they can't find the files, somebody's neck must get chopped off for that. Because I understand what has happened. They begin to hide files and nobody don't know and the whole thing. But somebody's daughter died. And somebody's granddaughter died. And the mother died. And therefore, we have to show a level of professionalism in this country. We have to stop fighting and backbiting each other. But if people have not done their duty, they ought to be dismissed.
Understood. Now, another issue that has come to the forefront, or a conversation that's being had in this space, is the status of the current CEO of the TRHA. Persons have raised that he had previously been fired or dismissed from the PTSC. Do you think that this has any real bearings on his current performance as the CEO?
Well, in the first place, he doesn't have any training. Training at MPH. He has no, from what we can gather from when you look at the files, he has absolutely no training that should qualify him to act as a function as our CEO. And he doesn't have even a master's degree in management studies, which would have been okay, right? So then you can't have somebody who is absolutely incompetent to be at the helm of our TRHA. As far as I'm concerned, he should have been removed a long time. He was dismissed from his former job and brought here, and this administration inherited him. But clearly, from all the horror stories you are hearing here in Tobago, then he's absolutely, he's overstayed his time. A young lady sent this information to me who was in the medical system. Good morning, sir. Life greatest tragedy. Death of baby and mother. Delay in opening of maternity unit in the fullest way at Roxboro do have consequences. Cesarean section and timely surgical intervention for cascading third stage bleeding was a possibility at Roxboro Hospital. So that former person who was in the system is saying the woman was experiencing third stage bleeding, and the interventions for that could have been done at the Roxboro Hospital. It wasn't there for her to experience that intervention, and where she might have most likely would have been alive today. Then she quotes Luke 16:1-12, a profound parable about stewardship come to mind. And therefore, people are tired, they are fed up of inefficiency, backbiting, internecine warfare. I don't like you, you don't like me. They don't like Dr. Duke, they don't like Dr. Singh. They don't like this, and everybody wants to get their way. The secretary must put her foot down. The board should have ensured that the necessary interventions were available and should have been undertaken. And the CEO, he is directly involved in this because he is the chief executive officer to whom the Roxboro Hospital comes under. I hope that there are some players, key players in Signal Hill, who continue to interfere and to look into the affairs at Roxboro. And the secretary and the CEO needs to cut that. Roxboro needs to be autonomous but collaborative with Signal Hill. The Roxboro Hospital needs to be autonomous but collaborated with Signal Hill, and that should be the modus operandi to ensure that both systems can provide the best quality health care for all of Tobago. It is not happening now, and we need to fix that as little while. We can't have people from Scarborough continuously interfering because you don't like doctor. He's a go-getter. You don't like this one. You don't like that. What is that? Keep your personal affairs to yourself. Keep your personal dislikes to yourself. They put this man there, came back from the United States with his fellowship and all his international training, and he has put Roxboro together. You know the amount of people that come from Scarborough up there to get medical care? Because the system up there, it works wonderful. People are happy to come up there. This is the only area that the board has not taken full responsibility for. I do not know, I'll say this, she might be angry with me. Get a proper chairman now. If the chairman is busy with her legal work and she has to function as chairman here, is she too busy? The next thing that they would like to hear, you have a junior doctor on the board, she's junior. Can she really make policy for people like Dr. Singh and Dr. Duke and all these senior professionals? It's not about young people time. Look around the world and see the kinds of people who really run the world and make the world successful. They're not young people. They have their place. But the people who have the wisdom
But I don't
and
think
the experience, I'm not pounding the doctor, I'm just saying she's a professional. But I'm saying in making policy at that level, you need an experienced doctor. Now they will say, well, people don't want to serve. But there are people who are living here, and I can identify, if you won't call names, who they can find and give them the latitude to do their work in policy development.
Right.
It's about policy that you don't put a junior to make policy for somebody.
But you
senior.
understand, Mr. James, that you don't put everybody with the same type of capacity or the same type of skill on a board. You
But
bring
you see-
people with different offerings.
Yes,
Because
but you-
even if she may not be able to, bring to the board medical policy, she might be able to bring communication policies for how to implement and how to communicate the policies that the board is
Let me
working
tell you
on.
something,
So
Shannon.
by saying that she's young and inexperienced in being a doctor,
You want
does the-
experienced people.
you don't.
Let me tell you flat. You need experienced people. You know people who can imbue confidence in their seniors. The board cannot function without a doctor. It will be unlawful for the board to be in place if there's no medical practitioner on the board. That's just the law. And I can tell you, sometimes they try to override it, but that's the law. And if you're going to put a doctor, let's put one that has experience. It's basic. And everybody could make an argument for it, or against it, But if you're going to put a doctor on the board, find him or her, whether even if it's from Trinidad. Because we have audiovisual facilities and you can stay anywhere in the world and make a contribution. But for goodness sake, find that person. You want somebody so that the policies that emanate and come from the board, they are sound. Policies that you can have confidence in respect of medical interventions. We don't have that here. You have a doctor, but you don't have that with the kind of experience. As a citizen and as a professional myself, I make no bones about saying that.
Understood. Guys, we want to thank you for sticking with us this morning. Thank you for your likes, your shares, and your comments. Thank you for being a part of our discussion on Good Morning Tobago here this morning. Again, I want to thank you for being here with us this morning, Mr. Max James, and I also want to say a special thank you to Dr. Vanessa James for being with us earlier, guys. Again, thank you for making Tobago Updates the #1 broadcaster here on the island of Tobago. And we're going to have a good day today, all right? Have a good day. Goodbye.